Fertility challenges can affect anyone, regardless of race or socioeconomic status. Minority communities face unique barriers in reproductive health. These disparities lead to delayed diagnoses and poorer outcomes. It's crucial to work towards equitable fertility care for all. Understanding these disparities is the first step towards addressing them.
Studies have consistently shown that African American and Hispanic women experience higher rates of infertility compared to their white counterparts. Several factors contribute to this disparity, including a higher prevalence of certain medical conditions that can impact fertility. These conditions include uterine fibroids, endometriosis, and pelvic inflammatory disease, which can disproportionately affect women of color. Delayed diagnosis and treatment also play a significant role in the higher rates of infertility among minority communities. Limited access to health care, lack of insurance coverage, and cultural factors can all delay seeking medical attention for reproductive health issues. This delay can allow underlying conditions to progress, potentially reducing the effectiveness of fertility treatments when they are eventually sought. Furthermore, socioeconomic factors such as poverty and limited access to education can contribute to health disparities that impact fertility. Addressing these broader social determinants of health is crucial to achieving reproductive equity.
The high cost of fertility treatments poses a significant barrier for many individuals and couples, but it disproportionately impacts minority communities. Fertility treatments, such as in vitro fertilization, can be prohibitively expensive. Insurance coverage is often limited or non-existent, adding to the financial burden. Geographical disparities further exacerbate these challenges. Clinics are often concentrated in urban areas, leaving rural communities with limited access. This requires travel, time off work, and additional expenses, compounding the strain.
Section 4. Cultural stigma. A silent barrier to seeking help. Cultural stigma surrounding infertility can be a powerful deterrent to seeking help, particularly in minority communities. In many cultures, infertility is a taboo subject, shrouded in shame and secrecy. This stigma can prevent individuals from discussing their struggles with family, friends, and even healthcare providers. Misconceptions about infertility, such as the belief that it's solely a woman's issue or a consequence of lifestyle choices, can further contribute to feelings of guilt and shame. These misconceptions can prevent individuals from seeking timely medical advice and support. Culturally sensitive care that acknowledges and addresses these stigmas is essential to creating a welcoming and supportive environment for minority patients.
Section 5. Health disparities and medical bias, adding to the complexity. Health disparities, including higher rates of chronic diseases and lower life expectancy, disproportionately impact minority communities and can contribute to fertility challenges. For example, conditions such as obesity, diabetes, and hypertension can all negatively impact reproductive health. Medical bias, whether conscious or unconscious, can also play a role in disparities in fertility care. Studies have shown that minority patients may receive different treatment recommendations or experience longer wait times for appointments compared to their white counterparts. Addressing medical bias requires systemic change within healthcare institutions, including diversity training for healthcare providers and implicit bias training to address unconscious biases.
Section 6. The intertwined journey of mental health and fertility. The emotional toll of infertility can be significant, leading to stress, anxiety, depression, and relationship strain. For minority communities, these challenges can be compounded by the added stresses of cultural stigma, socioeconomic disparities, and experiences of discrimination. Unfortunately, mental health stigma, particularly in some minority communities, can prevent individuals from seeking the support they need. This can create a vicious cycle where untreated mental health issues exacerbate fertility challenges, leading to further stress and emotional distress.